Hey guys, it's Cass Nelson-Dooley, author of Heal Your Oral Microbiome. And we're talking today about the oral-gut connection. Many people don't even think about the connection between the mouth and the gut. Dentists treat the mouth, doctors and functional medicine practitioners treat the gut and other systemic health issues. But really, these two are very connected. And I'll just put out a couple of lines of evidence that proves this. One is really obvious. We're swallowing mouth bacteria all day, every day, to the tune of billions of bacteria. So yes, that can affect the gut. And also researchers have found oral bacteria, oral pathogens in the small intestine. So we know that they make it to the gut and they can cause trouble. In fact, these researchers even said the mouth is a reservoir for bacteria that can cause gastrointestinal illnesses. There are also a long list of gastrointestinal illnesses that have a reflection in the mouth, whether they show an oral microbiome that's out of balance, or if they just show oral manifestations like mouth sores and problems in the mouth. Examples would be colorectal cancer, esophageal cancer, stomach cancer, pancreatic cancer, but not just cancers, also stomach ulcers or gastritis, inflammatory bowel disease, irritable bowel syndrome, SIBO, small intestinal bacterial overgrowth, appears to have an imprint in the gut. Also celiac disease. We know it affects the gut, but it also shows up in the mouth. These two areas of the gastrointestinal tract are intimately connected. I call them kissing cousins. Lastly, I want to tell you about an oral pathogen called Porphyromonas gingivalis. This guy is notorious. He's known to be a bad guy in the mouth. He can cause gum disease. But he's also been implicated in trouble all over the body, including the brain. He's been recently implicated in potentially triggering Alzheimer's disease and affecting the brain. Well, this bacteria, when you swallow Porphyromonas gingivalis, it can cause gut dysbiosis or imbalanced gut microbiome. It can cause inflammation and inflammatory immune cells to be swallowed, and they set up inflammation in the gut. And then lastly, this same bug has been shown to trigger intestinal permeability or leaky gut. So the three things that we've seen with this bad bug from the mouth can be a perfect storm for setting up a gastrointestinal illness for someone. So I really encourage clinicians to look at the gut and the mouth when they are treating someone with illness. And I want patients, consumers, to know about this connection so that they can advise their clinicians that it's something they want looked at and investigated. I have an amazing case study on my blog this month on this topic, on the oral gut axis or oral gut connection. And this case study is of a 37-year-old woman who had severe eczema, medicated with steroids. It was troubling her whole life. She also had bleeding gums and cavities. She had constipation and severe fatigue. And she had a very interesting approach. She had a functional medicine practitioner and a functional dentist who both worked on her health. They tested, they treated, they found dysbiosis in her mouth, they found dysbiosis in her gut. It was also uncovered that she had nutritional deficiencies. And they went through a very rigorous treatment plan that took time, but treated the dysbiosis in her mouth, treated the dysbiosis in her gut, changed her diet, she took supplements, she made lifestyle changes, and today her skin is gorgeous. She does not need steroids. She has regular bowel function today. Her oral pathogens, some of the bad bugs that were in her mouth, were disappeared or have all gone down. Her gut test looks healthy. She has beautiful, healthy gums, and her inflammation is gone. So now, occasionally she will get a flare-up of her eczema, but she completely can manage it, and she knows what triggers her eczema now. So this was an amazing success story of treating both the oral cavity and the gut, and really turning around a young woman's life. So, and that was through the use of functional dentistry and functional medicine. Thanks to Dr. Sarah Poteet, who contributed that case. And I also want to say thanks to our sponsor, Terra and Company. They have this amazing gentle green pulling oil, which soothes and moisturizes your mouth and cleanses your mouth without drying, stripping, or killing your good bacteria. So they also have a wonderful line of non-toxic products that I love. I really like their Brilliant Black dental floss. It's my #1 favorite non-toxic floss. So thanks for watching, and we will see you next time. Thanks.